Hello, my name is Benjamin Mercer, and I am a senior civil engineering student at the University of Kentucky. Today, I will be talking about environmental health and engineering by introducing the concept of housing insecurity and how it relates into environmental health. I will then discuss one thing that an engineer could do to provide a remedy to this issue, and finally end the presentation with the main thing that I liked about this class. The National Environmental Health Association, or NEHA, currently serves 6,000 members to advance the environmental health and protection professional for the purpose of providing a healthful environment for all. According to NEHA, environmental health is the science and practice of preventing human injury and illness and promoting well-being by identifying and evaluating environmental sources and hazardous agents, and limiting exposures to hazardous physical, chemical, and biological agents in environmental media that may adversely affect human health. Environmental engineering is defined as the branch of engineering that is concerned with protecting people from the effects of adverse environmental effects, such as pollution, as well as improving environmental quality. Environmental engineers work to improve recycling, waste disposal, public health, water, and air pollution control. Engineering fits into environmental health in that engineers may use their expertise and knowledge to test environmental factors for risks or hazards to public health. This may include monitoring the air quality in different areas in order to detect potential public health hazards, designing and managing different water control systems, or developing management systems of human waste. The hierarchy of controls is a means of determining how to implement feasible and effective solutions. The idea behind this is that the control methods at the top of the graphic are potentially more effective and protective than those at the bottom. Environmental engineers use this hierarchy on a daily basis in order to protect the environmental health of the public. Our biggest goal is always to eliminate the hazard itself, and if this can't be done, then we try to replace the hazard with a lesser hazard, followed by using engineering controls, administrative controls, and worst case scenario using personal protective equipment. The social ecological model is a way to understand the factors that contribute to a problem in order to work to prevent it. It allows us to understand the range of factors that put people at risk and is a way for us to figure out a way to protect them. In class, we use the social ecological model in this same manner, first by identifying a problem that we are working to find a solution for, and then by filling out the model with biological and personal history factors that increase the likelihood of the problem affecting you, the relationships that may increase the likelihood of the problem affecting you, the settings such as schools, workplaces, and neighborhoods that may increase the likelihood of the problem affecting you, and the broad societal factors that may create a climate in which the problem is encouraged to continue. The concept of housing insecurity is the lack of security in an individual shelter that is the result of high housing costs relative to income, poor housing quality, unstable neighborhoods, overcrowding, and sometimes homelessness. According to the article Housing as a Determinant of Health Equity, a Conceptual Model by Swope and Hernandez, housing is a major pathway through which health disparities emerge and are sustained over time. Swope and Hernandez created a holistic conceptual model of the impact of housing on health disparities, which shows how structural inequalities shape unequal distribution of access to health promoting housing factors and spans four pillars: cost, conditions, consistency, and context. When it comes to costs, significant disparities exist in housing affordability, stemming from income, race, and ethnicity. Living in unaffordable housing is associated with poor, self-rated health, hypertension, arthritis, and mental health. When it comes to the conditions of the homes, the inability to maintain thermal comfort can affect residents' health by interfering with the body's ability to thermoregulate. Pests can cause and trigger attacks of allergic sensitization, and a wide range of harmful environmental exposures from within the home, like lead, can cause irreversible adverse health effects. When it comes to the consistency pillar, there are many reasons why involuntary moves could occur, including inability to afford rising rents or mortgage payments, eviction or foreclosure, natural disaster, and government policies. Evidence indicates that residential instability is associated with a wide range of adverse health outcomes, including poor self-rated health, healthcare access, and mental health outcomes. Finally, when it comes to the context pillar, a rapidly growing body of research indicates that neighborhood characteristics and resources exert an effect on residents' health independent of individual level attributes. Each of these factors relates to environmental health and engineering, and that according to the NAS Grand Challenges for Environmental Engineering, one of our main challenges is to create efficient, healthy, and resilient cities. Housing insecurity contributes to unhealthy cities, and it is our job as engineers to work to combat this and make sure that each person has the same opportunity to live a healthy and safe life. The Greater Louisville Project is an independent, nonpartisan civic initiative that works to provide this to the city of Louisville, helping to connect the dots between education, jobs, health, and quality of place for residents that may experience these housing insecurities. As environmental engineers, our duty is to strive to fulfill the NAS Grand Challenges for Environmental Engineering, along with protecting the health and safety of all people. Therefore, we must do what we can to help work towards a solution with respect to housing insecurity so that we can eventually have a day where no one has to worry about the effect that their shelter is having on their health. One simple thing that we could do to protect the health of people facing housing insecurities is testing the air quality inside these homes to determine whether or not it is safe for everyday use or not. As humans, we cannot live without air, and we spend most of our lives inside where the air quality is typically worse than the outdoor air quality, which is why I would first approach the problem in this manner. By going into neighborhoods where people have more of a tendency of getting sick and having health problems, along with neighborhoods with dated infrastructure, we can determine if their air qualities meet the EPA requirements or not, and in turn implement a solution so that the air these people are breathing in is not a reason that they may be getting sick and having health issues. The following is a social ecological model that maps my hypothetical approach to this problem across the various ecological levels. The problem statement for the model is that many less fortunate people facing housing insecurities are also showing a greater likelihood of getting chronically sick throughout their lives. And as an engineer, I am looking to fix this problem by first testing out the air quality inside their homes to see if this is an issue that is affecting them. If it is, then we will design mitigation solutions for these homes that protects them from whatever may be making them sick. At the personal level of the social ecological model, humans need air to breathe, and humans spend most of their time inside, making this a very important problem that needs to be solved. At the interpersonal level of the SEM, families live in the same homes under the same conditions for decades, which is why entire families are getting sick. These families also didn't have enough money to renovate their homes, and a lot of their income is going to rent and not to personal health. At the community level, organizations such as the Greater Louisville Project get involved with cases just like these. Also, these health issues stem through the entire community, and these community members don't want to leave, so we need to fix the problems in the homes to make them habitable. Finally, at the policy level of the SEM, there are policies ensuring that housing is safe enough to be habitable by community members, and there are government programs funding projects in communities with housing insecurities, as well as the EPA has standards for safe indoor air quality. To wrap up my presentation, I'm going to give a little rundown of what I liked in CE 599. Before taking this class, I really didn't fully understand what environmental engineers do and how key of a role they can play in striving for environmental health and environmental justice. Design Project 1 really opened my eyes up to this and taught me some of the obstacles that environmental engineers must deal with in order to provide a solution to the problem at hand. With vapor intrusion, and honestly any other test that we are taking, we may have very limited data at hand to initially address an issue and determine if there was a problem that needs to be solved. We must use engineering judgment to determine which data is useful to us, and then determine which methods we can use to analyze the data at hand in order to determine if there is a problem. Once the issue is determined, we still may face roadblocks within the community with opposition from residents and local governments, and with opposition from companies that may not believe that they are at fault for causing the issue. This project really enforced the idea that environmental engineering is not all about the data and the numbers that we are presented with, but also with creating relationships with the communities that we are working with so that we are able to implement a solution if needed. In my career, I will always remember that my first step in trying to solve a problem is gaining the trust of the people that I'm working to try to protect, and in making sure that I'm engaging with each of the stakeholders of a project so that the developed solution is feasible and accepted by all. Overall, I really enjoyed my time in this class and with learning about the experiences that Dr. Pennell has had throughout her career. I'm now definitely more inclined to explore deeper into environmental engineering throughout my graduate studies. Here's some of my references for my presentation, and that is it. Thank you very much for listening.